I'm Judith Chavez.
Okay, so what are the different positions you've held in your career?
When I start after passing the board exam, I applied in Philippine Heart Center and I was admitted, accepted there as a staff physical therapist. So I worked there as a staff PT for about 3 years, and then after that I was promoted as a chief PT of Philippine Heart Center for 2 years. So my stint in Heart Center is uh, just about 5 to 6 years, and then when I had children, I had to change the way I work. So I went into home health to be able to focus on the children. That's it.
Okay, so regarding your current work, may we ask about some of the roles and responsibilities you have to uphold?
Okay. In my current work, since I do part-time work and mostly I'm responsible for like scheduling things, and it's lighter compared to working in a clinic. So the things I do are basically just taking care of the patient, his condition. So I'm answerable only to the doctors who refer the patients to me and to their relatives. Basically, the welfare of the patient is what I'm into.
Okay, so next we want to know, since we are people looking forward to working in the medical field, some of your experiences in the area. What about working with your different colleagues?
Okay. It's good to work in a clinical setting because when you work with other PTs, you have different styles of working. So somehow you get to see them how they work, and then you get to try to do things, and then you get to compare notes. So mga best practices of the other PTs, they share it with you. So somehow, if you work in a clinic, there's more sharing of the wisdom that you have gained through the years, and then especially if you have someone who is more senior than you, he can mentor you on the things that they know. So if you really want to grow in your work as a PT, if that is really your priority, the clinical setting is best for me to go into.
So can we have a bit of a general idea of what we can expect in the environment that you're in?
So when I work in Heart Center, siguro yung the organizational thing that you have in the hospital is that you have a physiatrist or a rehab doctor in charge of the whole clinic, and then there are a group of rehab doctors who are there. So we are all your bosses, but we have a head of the clinic, and then there's a chief PT, and then there are staff PTs. So you will be working with them, and then you will also be co-working with the other areas of rehab. Like you will be co-working with OTs, you will be co-working with speech therapists. So that's the way it looks. So mostly as PTs, we are in charge of the how to make the patient move about, like sitting, standing, walking. And then after a while, there are some things that we cannot address, like hand function. So
So since you have worked, as you told us, as a chief PT and a staff PT, would you mind telling us some of the different experience comparing the two?
Okay. So if you work as a staff PT, you're mostly in charge of the clinical welfare of the patients, and then there are some interns which you will oversee. So mostly you look after the patients. You have the last say on what exercises that you will give the patient, and then you oversee, you supervise the clinical physical therapy interns. And then if you work as as a chief PT, it's mostly administrative work. So like we do the paperwork, we do overseeing the whole clinic and how to make it better in terms of the number of patients who are coming in, increasing the statistics of the number of patients who are coming in, and then increasing the satisfaction of the patient. So mostly if you are a chief PT, it's admin work. So you do all the reports and everything, and then you oversee all the staff PT. So that's the difference.
So, about the nature of your patients, what are the top 3 commonly encountered health problems or disorders you've encountered?
Since I work in heart center, so most of our patients are cardiac patients. And then, so that's one, cardiac patients, and then stroke patients. And then the other one is a combination of ortho problems for the elderly, since we cater mostly to elderly patients. So that's it.
So, what do you think are the different causes or maybe factors that contributed to the development of these diseases?
I think lifestyle is one thing, like the patient's diet, what the patient is used to in terms of his diet. And then the other thing is stress is a major factor. Uh, Stress, the working conditions or of the patient. Another thing is maybe genetic, like the makeup of a patient is contributing to the condition or illness of the patient.
So, is there a possibility to prevent these health problems that you brought up?
Yes, there are a lot of preventive measures that we can do.
So, what are these and how would you classify them according to levels of prevention?
Okay, so we have 3 levels of prevention, like the primary level. So that's when we put ads, like for example, commercial ads or the posters that we use, like no smoking, the ones that we put in the cigarettes. Okay, so what will happen to you if you smoke cigarettes? So those are the primary preventive measures that we can have. And then the secondary preventive measure is seeing signs and symptoms with the people around you, especially your loved ones. Like, for example, there's a change in the sleeping pattern of your loved one, or there is a difference in the smell, for example, difference in mucus or different in coughing, difference in coughing. So those are some of the things that we can look after. And then the tertiary prevention is if the disease is already there, um, we can do some what I call maintenance physical therapy exercises. So the disease is already there. What we will do is to prevent the patient from further deterioration by doing exercises to maintain his present ability. So that's it.
So, as a healthcare provider, particularly a physical therapist, what are some of the procedures or measures you do to ensure safety in the workplace for both you and the patient?
Okay, for us PTs, it's because you're in close contact with the patient, so it's important that you always clean the equipment or the things that you use. And then if the patient is known to have pulmonary uh, problems, so you have to wear a mask. And then for PTs, because it's a very manual work, it's important for us to have proper body mechanics when lifting our patients, when moving them from one position to the other. So that's how we as PTs take care of ourselves. And then to ensure safety for the patients, it's important to, in the clinical setting, to put like rubber, for example, in the stairs where they will have to walk. We put rubber lining in the stairs, and then in the bathroom there are also rubber floor mats that we put to to ensure that there will be no falls. And then when we transfer patients, we use gate belt or transfer belt so that we can hold on to them just in case they fall off or they have an accident. At least we'll be able to prevent falls. So those are some of the things that we do.
Right, that's the end of the interview. We'd like to thank you for giving the time, and we have really learned a lot from this experience.
Okay, thank you also for interviewing me. It was a pleasure.